the videos that we have. So Risatek, a big thank you to you. So on this note, I would like to introduce our presenter for today. And our presenter for today is from Ghana. She is Ghana's pioneer respiratory therapist with over 5 years of experience in managing critically ill patients and has worked on several multidisciplinary teams, including the University of Ghana ICU team for critical ill COVID-19 patients, National Conjoint Twin Project, where she served as the only respiratory therapist among the 100 plus clinicians, the Global Fund Project in collaboration with Ghana Health Service, where she educated over 1,000 clinicians on ventilator modes, the renal transplant team at the University of Ghana Medical Center ICU, and the Mayo Clinic Certain Ghana cohort. She also holds a master's in clinical leadership and management from the University of Ghana Business School. She currently serves as the regional health education lead, Greater Accra, for Global Asthma COPD outreach. She is also the organizer for Ghana Association for Respiratory Care. She is an active member of the Africa Respiratory Care Association. She is passionate about advancing respiratory care across the continent and also, especially in her country. She is actively engaged in professional development, global health discourse, knowledge sharing initiatives, and aimed at improving patient outcome and expanding respiratory care services and in resource limited settings. In recognition of her exceptional leadership, she was selected to represent University of Ghana Business School at the 2025 Berlin Global Dialogue in Germany. She currently works as a respiratory therapist in the intensive care unit of one of Ghana's prestigious quaternary hospital. Our presenter for today is Emanuela Odro Yeboah. Emanuela, our audience, our presenter. Thank you.
Thank you so much, Dorothy, for the brilliant introduction. Hi, everyone. I'm super excited to be here with you this morning, afternoon, evening, depending on where you're watching me from. And greetings to you from Ghana. I'm grateful to the ARCA board and leadership for the opportunity to lead this presentation for today. Standing on existing protocol, we are grateful for the participants who are here today. I will quickly share my screen and kickstart today's presentation, if I may. All right, please, are my slides visible?
Yes.
Okay, sorry. Wonderful. Well, today, I believe all of us know why we're here. We're here to go over the overview of the respiratory care profession and its impact on our health systems. Right, before I start, here's a simple disclaimer. This presentation is intended for educational and professional development purposes only. The views expressed are based on current global evidence, international respiratory care standards, and professional experience. They do not in any way reflect the official stance of any regulatory authority, institution, or employer. This session is also not a substitute for institutional policies, national guidelines, or formal training. And the goal of this webinar is to foster informed discussions about the respiratory care profession and its future trajectory within the African context. So today, by the end of this session, I hope that we get to understand the scope and practice of the respiratory care professionals globally. We get to understand the importance of respiratory care in managing respiratory diseases as well. The contribution of respiratory therapists to healthcare systems and patient outcomes, and why we need to strengthen respiratory care education and workforce development in Africa as a continent. So everything that exists currently has a beginning, right? So respiratory care didn't start from Africa. neither did it start from Ghana. Okay, although I am from Ghana, respiratory care started in the United States, particularly in Chicago in the 1990s. And over time, it spread to Asia, Saudi Arabia, and Canada in the 2010s, eventually reached Europe. But in Europe, they don't call it respiratory therapy. Okay, there are different names for the same profession across the world. Okay, and eventually reaching Africa. Thankfully, Ghana was one of the first countries to champion the cause of respiratory care and establish respiratory care programs on the African continent. So, what at all is respiratory therapy? I've had a few people ask me. So, today, I hope by the time I'm done, you don't have to ask a second time. So, respiratory therapy is basically a specialized healthcare profession which focuses on diagnosing, treating, and managing respiratory disorders in patients to help them to breathe better. Okay. And once you breathe better, then the overall quality of your life is better as well. Now, we are not doctors, respiratory therapists are not nurses. However, we are allied health professionals. Someone will ask, what is an allied professional or who is an allied health professional? If you know a physiotherapist, then you know who an allied health professional is. If you know a dietitian, then you know who an allied health professional is. Okay. So basically, the cadres in medicine, okay, are subdivided into several groups, and allied health professionals are just one of the groups involved. Now, when it comes to the patient population for respiratory therapists, from neonates up until the most elderly patients, you would find that each one of those classes would benefit from the intervention of a respiratory therapist. Okay, so the patient population is not limited at all. We are able to care for the smallest babies through to the oldest adults. Where do respiratory therapists work? So in hospitals, you'll find respiratory therapists typically in the emergency department, in the neonatal ICUs, general or post-surgery ICUs, and in some places, even in the operating theaters. You'd also find respiratory therapists in diagnostic laboratories like pulmonary function test labs and sleep laboratories. Okay, there are also respiratory therapists in rehabilitation facilities and some skilled nursing facilities. These are just places you will find RTs in clinical areas. Now, in non-clinical areas, you find RTs involved in teaching and educating the next generation of respiratory therapists. So you find RTs in education and research, spearheading wellness programs, involved in policy development and leadership as well. Now, with our scope of practice, respiratory therapists perform roles across different countries, okay? And we are licensed to diagnose, treat, manage, and educate patients with cardiopulmonary disorders and diseases. So some of those diseases are like asthma, like COPD, like congestive heart failure, like prematurity. As long as the disease process affects the patient's breathing, you are most likely to find a respiratory therapist in that situation. So let's talk about the scope of practice in depth. Okay. In clinical areas, we manage patients on life support machines. I'm sure during the COVID-19 pandemic, a lot of people heard ventilators online for the first time. And one of the things I heard people say were which people manage the ventilators, right? And today I'm here to tell you that your respiratory therapists manage ventilators across the world. However, in some countries where there are no respiratory therapists, you'll find anesthesiologists managing the ventilators. Respiratory therapists are also skilled to administer oxygen therapy to patients, aerosol drug administration. By aerosol drug administration, I mean when a patient has asthma and they put that liquid medication in the nebulizing chamber and you see some mists coming out, kind of looks like vapor. That is aerosol drug administration. Okay. Then airway management as part of rapid response teams. So typically, if you you've ever seen or witnessed a resuscitation or a code blue event, you most likely find respiratory therapists at the head end of the patient, managing the patient's airway. Okay, we're also involved in air and ambulance transport for critically ill patients and also pulmonary function testing, like I mentioned earlier. There are patients who have respiratory issues or lung issues that need to be confirmed through a test called spirometry testing. Okay, so if a patient has a confirmed asthma diagnosis, most likely they would have had a pulmonary function test or a spirometry test done. So you'd likely have a respiratory therapist in those areas or in the pulmonary function lab carrying out the spirometry procedure. In non-clinical areas, you'd also find respiratory therapists involved in the sale of medical devices, also as application specialists, where you meet them training the clinicians on how to use particular devices like high flow systems, like ventilators, like oxygen therapy systems, and a host of others. You'd also find respiratory therapists as program directors for respiratory care programs, as college professors or lecturers, as researchers, and also as leads for wellness programs and pulmonary rehabilitation programs. Now let's talk about the role of respiratory therapists in managing respiratory care or in managing respiratory diseases. To begin with, respiratory therapists are skilled to assess and diagnose patients. Okay, like I mentioned earlier, we conduct pulmonary function testing and arterial blood gas sampling and analysis. Okay, so yes, your RT can take arterial blood from you as a patient. We also administer therapeutic interventions to our patient through inhaled medication, oxygen therapy, like I mentioned earlier, and through simple airway clearance techniques. In some facilities, depending on the legislation that is available, some respiratory therapists may be involved in bronchoscopy assistance, ECMO, which is a more advanced procedure, and in most places, mechanical ventilation and critical care. So, respiratory therapists may be involved in endotracheal intubation, invasive and non-invasive ventilation, as well as part of the rapid response team, like I mentioned earlier. Some respiratory therapists also are involved in pulmonary rehabilitation programs, like I said, depending on the country and the legislation available. So when it comes to asthma, what do you expect your respiratory therapist to be doing? Most likely, they will provide you with a spirometry test, as well as administer bronchodilator therapy, the medication that helps reverse the inflammation that's ongoing and the bronchospasm in the airway of the patient. Okay. They would also teach you how to properly use your inhaler and to track your airflow through a peak flow monitoring, right? There's also another disease process called COPD. And in an exacerbation, you find your RT assisting with management and also providing pulmonary rehabilitation for the patients involved. With cystic fibrosis, most of those patients tend to have a lot of secretions or phlegms, what we typically call phlegms, right? And so in those patients, your respiratory therapist will be involved in airway clearance and long-term ventilator management where applicable. Now, for babies that are born before term, okay, premature babies, respiratory therapists are involved in ventilating their little lungs so that we don't cause more harm than good, and also involved in the administration of surfactant to help with their lung compliance. There are some patients who end up having obstructive sleep apnea, which can affect several systems in their body. And so for those patients, you will find respiratory therapists administering CPAP or non-invasive ventilation therapy for those patients, especially at night. Now let's look at the impact of respiratory care on our health systems. According to a research that was conducted by the University of Arkansas for Medical Sciences, there was a discovery that patients had 3.7 times better outcomes when they had respiratory care or respiratory therapists assigned to them. Okay. There was also a 25% reduction in mortality rates among critically ill patients who were ventilated. And they also recorded 15% shorter stays in like ICUs. Now, why do we need to strengthen respiratory therapy programs and develop the respiratory therapy workforce in Africa? Um, a lot of the times we wait until something happens before we trigger an intervention, which is the last thing we want when it comes to healthcare, right? And with the rapid urbanization, high risk of pollution, and increasing risk factors that we currently have globally, there's a surge in chronic respiratory diseases. Okay, so we are seeing more incidences of asthma and COPD and even prematurity among the population. This requires or has demanded the need for specialized respiratory care professionals. And that is why we are advocating for the need to increase respiratory care programs, especially across Africa. With an increase in risk factors for respiratory disease across Africa, it's super important that we establish respiratory care programs to develop specialists who will be handling these diseases when they come up. Okay. There's also a large gap in specialized respiratory care programs, and there's a growing need for respiratory therapists, like I said, because of the increase in chronic diseases across the continent. There's also high mortality rates associated with respiratory diseases. Now, let's talk about the role of the African Respiratory Care Association. So, the African Respiratory Care Association is a Pan-African healthcare organization dedicated to strengthening respiratory care education, practice, and research across the African continent. Now, like I said before, there's an increasing demand for respiratory therapists globally, especially on our continent, right? And through ARCA, um, different countries in the African continent can collaborate to set up respiratory care programs to train respiratory therapists who will in turn handle the growing burden of respiratory diseases across the continent. Now, as an organization, we envision a future where every African nation has a thriving respiratory care professional community, has access to quality respiratory care, and irrespective of your location, you don't need to travel to another part of Africa just to get respiratory care or to have a respiratory care professional attend to you. Okay, so ARCA, one of the goals of ARCA is also to establish research and innovation across the continent. To our dear policymakers, please, we're entreating you to prioritize the inclusion and recognition of respiratory care programs into our education and healthcare system. Additionally, please support the accreditation of respiratory therapy programs across the continent and in the countries you find yourself in. And most importantly, please help us fund respiratory care education programs and research. To our government officials and health education ministers or ministries involved, please collaborate with bodies and institutions like the African Respiratory Care Association to set up respiratory care programs, help invest in respiratory care equipment in our hospitals, support public awareness campaigns, and drive change, and also help us adopt regional policies to enhance the employment pathways for respiratory therapists across our continent. Now, if we look at this map here, right on here, we can see that there are very few countries indicated in green. Okay, these countries are countries who are championing the cause of respiratory care. There are also other countries like Nigeria who have plans underway and have started discussions towards establishing respiratory care programs. However, if we compare the countries in green to the countries in gray, we can tell that there are very few countries in Africa who have fully established respiratory care programs. So we're entreating all our policymakers, all our healthcare institutions, organizations who prioritize healthcare, social entrepreneurs to please help us champion the cause of establishing respiratory care programs across the African continent because there's an escalating crisis of respiratory diseases. Okay. And we don't want to wait until something happens before we find the need to establish these programs. We need to improve our survival rates and the quality of patient care across our continent. And that's why it's essential for us to continue to push for respiratory care programs to be established in the continent. Now, before I hand over the microphone back to our moderator, we can all agree that the question is no longer whether Africa needs respiratory therapists. There's enough data that answers that. However, the real question is whether our health system will act fast enough to integrate this essential profession into our care teams, into our policy frameworks, and into our workforce. Thank you so much. At this point, I will hand over the microphone to our moderator, Dorothy.
Okay, thank you very much, Emanuela. Dear participants, I urge you to, if you have your questions, you can put them in the Q&A side and then it will be read for you. I also want to use this great opportunity to acknowledge the Director for Programs and Projects of the Africa Respiratory Care Association, Dr. Olugbenga. Dr. Olugbenga would answer most of your questions or will pick up your Q&A side to address them. So keep your questions coming. Thank you very much. Now, whilst we wait for your questions to come, there are some key individuals that I would like to specially acknowledge. We have participating with us the the VP for Strategic and International Affairs of Zopec Medical participating with us. This shows how Zopec is truly passionate about enhancing respiratory care across the continent of Africa. And she's in the person of Taya Lichty. Taya, thank you so much for supporting the initiative of Africa Respiratory Care Association. We also specially want to acknowledge the participation of faculties from Red Sea University, Garowe, that is in Somalia. We also want to acknowledge the Ministry of Health, Portland, in Somalia. We also want to acknowledge Ministry of Health and Social Welfare in Somalia. And especially, I also want to acknowledge the Ministry of Health of Ghana, also sending out delegates to participate in this maiden session of our webinar series. We have on our screen our proud sponsor, Zopec Medical. So Zopec Medical designs medical grade power solutions that prevent disruption of therapy and procedures by keeping essential devices running. Now, they are trusted by healthcare systems globally. And these solutions improve patient mobility, enhance safety, support continuity of care during power outages and transport. So if you're a healthcare facility or a healthcare provider or a hospital administrator watching us or a minister of health watching this webinar today, these are power solutions that would help in our healthcare facilities to ensure continuum of care whilst we give patients that care that they need. Thank you all so much for participating. Now, our questions. So we are ready to read your questions out. Keep them coming. Thank you.
Hello, good evening.
Good evening.
Good evening.
Yes, we can hear you.
Okay. I discovered that where we can type the messages has been disabled by the host. We cannot actually type questions there.
Okay, you can also put your questions in the chat side as well, if it is possible.
I've tried.
Yes.
It has been
So
disabled.
yes, the IT team is hearing you, so they would actually work on that. But put your questions in the chat box. We would read that also for you.
The chat is not active, so questions can be posted in the Q&A.
Okay, so you can put your questions in the Q&A. Thank you. So Q&A, when you look down your screen, go to more. And then when you click on more, you see Q&A. Kindly post your questions and we are ever ready to answer your questions. Now, without much ado, I would like to give some few individuals participating with us the opportunity to
formal respiratory therapy,
if possible. IT can go on. Thank you.
Across Africa, millions face life-threatening respiratory conditions.
Okay, so we have participating.
Across Africa, Millions face life-threatening respiratory conditions every day. Yet, in most countries, there is no formal respiratory therapy profession. Only a handful of nations offer any structured education in this life-saving field. The result? Preventable suffering and unnecessary deaths simply because of where someone was born. Today, the Africa Respiratory Care Association, ARCA, is changing that future. ARCA is a Pan-African healthcare organization dedicated to strengthening respiratory care education, practice, and research across the continent. Our mission: to reduce the burden of respiratory diseases in Africa by strengthening the respiratory workforce, providing opportunities for professional growth, and promoting innovative solutions to improve respiratory care. Our vision: to unite respiratory therapists across Africa and welcome external members, fostering excellence in respiratory therapy, care, practice, and education through professional growth, knowledge exchange, and international networking. With over 2,000 active members across more than 20 countries, ARCA is advocating for the official recognition, licensure, and regulation of respiratory therapy in every African nation, launching education programs and building university curricula where none exist, hosting annual conferences, workshops, and research initiatives, empowering the next generation through scholarships, mentorship, and international student exchanges, raising public awareness and fostering global collaborations to elevate standards continent-wide. We are not just an association. We are building an entire profession from the ground up so that quality respiratory care reaches every corner of Africa. To accelerate this urgent work, we need your support today. Here's exactly how you can help. 1. Donate. Every contribution, whether $10 or $10,000, directly funds training programs, scholarships, advocacy efforts, and the launch of respiratory therapy education in new countries. Your gift will train life-saving professionals and build stronger respiratory care systems across Africa. Donate now at www.africaresp.org. 2. Join as a member. Become part of our growing family of 2,000-plus professionals and supporters. Gain access to exclusive networking, continuous education, conferences, and the opportunity to shape the future of respiratory care in Africa. Visit africaresp.org and click Join as a Member today. 3. Become a vendor. If you provide respiratory equipment, technology, pharmaceuticals, or services, partner with us as a vendor or sponsor. Your products and expertise will reach professionals across 20-plus countries. Visit africaresp.org and select Become a Vendor. 4. Become a partner or volunteer. Global organizations, institutions, and individuals can collaborate with us through sponsorships, joint programs, or volunteering expertise. Together, we create sustainable solutions for better breathing, better care, and better lives. Contact us, email info@africaresp.org. USA office, +1 952 228 1482. Ghana office, PALS 233 0 pin 4 213 0397. Together, we can ensure no African is left breathless because of where they were born. Join the movement. Become a member, a vendor, a partner, or a donor today. Visit www.africaresp.org. Support ARCA's vision. Help Africa breathe better. Thank you for believing in a healthier Africa.
Thank you.
It's time for Africa. Let's rise and breathe as one. With the African Respiratory Care Association, our journey's just begun. Promoting excellence, our mission strong and true. For every breath we take, ARCA's here for you. We unite therapists across the African land, empowering breathing with a helping hand, advancing education and setting standards high. For every life we touch, ARCA's standing by. It's time for Africa. Let's rise and breathe as one.
Much. Okay, so I have some few questions coming in here. It says, I'm a nurse. How do I become an RT? This is an anonymous question. Okay, so depending on the country you are participating from, you would have to find out if there is a respiratory therapy program ongoing there, and then you can actually sign up. Mostly, the respiratory therapy program should be in the country's university. So in Ghana, we have University of Ghana. If you are in Ghana, then in Ethiopia, we also have universities in Ethiopia. We also have universities in Egypt as well. So depending on where but just like you saw in the presentation, not most countries in Africa have established this program yet. So that is where the challenge is. But if you still insist and want to become a respiratory therapist, you can identify these countries that have already started, and then you can go there and get the admission that you want. Okay, and then a question. It says, "Hello, madam. I am from Pakistan. Respiratory therapy. I'm from Pakistan, and he's a respiratory therapist. Can you hire job for respiratory therapists?" Okay, so in this question, in your home country, I believe there should be job placements by your government in your respective countries. So I think you should reach out to your country leaders. And in Pakistan, we have a country director, Salan Zafar. So if you can reach out to him, he can give you more directives on what you should do next. Thank you very much. And Sunshine Shaibu says, what is the difference between respiratory technician and respiratory therapist? So this particular question, I would want to put it out there. So the director of programs, Dr. Olugbenga, the presenter for today, any of us can take this question. So Dr. Benga, over to you. What is the difference between respiratory technician and respiratory therapist?
Good morning, good afternoon, good evening to everybody from where you are participating from. Now, it depends on what the terminology technicians use. So I will use a reference for the US. A technician is someone who actually helps the respiratory therapist in what they do. They are non-licensed. Most of the time, this job may be done by students in a respiratory therapy program, and they help to set up equipment. Um, um, they help with logistics if there are equipments that are needed from that needs to be taken to one place. This technicians will be the one that's going to take the equipment to these locations. So most of the time, the technician is a non-licensed profession. They are not respiratory therapists. They have not gone through the formal training of being a respiratory therapist. So, a respiratory therapist has gone to a formal program, either a 4-year school, or if they've gone advanced education. They are licensed by whatever state, country they currently work in, and they actually have a license to work as a respiratory therapist. So that's the difference between a respiratory therapist and a respiratory technician.
Okay, thank you very much. And then from South Africa, JC says, do respiratory therapists also manage pulmonary function testing lab? And the answer is yes. The answer is yes. Okay. And
Can I add to that, Dorothy?
yes, go ahead. Go ahead.
Yes, respiratory therapists are the ones that actually work in a pulmonary function lab. But for respiratory therapists that are working in the pulmonary function lab, they need a special certification, which they could either be a registered pulmonary function technologist, or they could be a certified pulmonary function technologist. This ensures that they have gone through the right training and credential to be able to perform the test as a pulmonary function technologist, and they know exactly how to better coach the patients to be able to get the maximum effort, because this is going to be used by the doctor, the pulmonologist, in the diagnosing of the patient.
Thank you very much. Okay, so an anonymous question. It says, thank you for the opportunity and the webinar. Is there a platform for Ghana ARCA, and how can I become a member? Is there any course available in Ghana for one to become a respiratory therapist? Okay, so maybe the presenter should take this answer. Emanuela, would you take this answer?
Yes. Is the person asking if there's a way to join ARCA or if there's a way to join respiratory therapists in Ghana? Which one?
So it's two questions, it's two in one. It said,
Okay.
how do I become a respiratory therapist? So the person is in Ghana. Is there any available course in Ghana, to become a respiratory therapist? And how do
Right.
I join the Ghana Association for Respiratory Care? That's the Ghana ARCA chapter.
Okay. Thank you so much. So, dear participant, yes, there's one program in Ghana currently that is admitting students for respiratory therapy. The program is held in the University of Ghana. And so to be able to join the respiratory therapy program or to be able to become a respiratory therapist in Ghana, you need to enroll or apply for University of Ghana admission and select respiratory therapy under the School of Allied Health Sciences for your application. And then once you are admitted into the program, you go through the 4-year curriculum or the 4-year program and then graduate, write your licensing exam, and you become a respiratory therapist. Additionally, you can easily join ARCA. The website is www.africaresp.org. There's not necessarily an ARCA Ghana chapter. We're all together. So you can simply join the ARCA organization by logging on to www.africaresp.org and you can simply join ARCA from there. Thank you. I hope this answers your question.
Yes. Yes. Okay, so let's move on. What are the membership categories of ARCA, and how much do I need to become a member? Okay, so we have, just like she said, when you go on www.africaresp.org, the membership categories we have are student membership, associate membership, professional membership, and international membership. So which means this gives the opportunity for everyone to become a member. If you are a non-health personnel and you have respiratory health at heart, you can become an associate member. If you are registering from an international country, which meaning outside Africa, then you register as an international member. And if you're a health personnel, you can register as a professional member. And obviously, for students, you are a student member. So someone says, do I need to do pure science before becoming a respiratory therapist? Yes, you need to have a background of science, that is physics, chemistry, biology, and elective maths, to become a respiratory therapy student in or enrolled in the university. Then we have further questions. Says, thank you for the opportunity. Please, my question is, what is the biggest integrating respiratory therapist into existing healthcare system across Africa? What is the biggest integration of respiratory therapists into the healthcare system of Africa? Please, your question is not so clear. It's not so clear. Can you resend your question again so that we can help answer your question properly? Madam, my question is, can you announce respiratory therapy vacancy in South Africa? I want to come to South Africa. Okay, so Mudassar, currently South Africa have clinicians, but they don't have respiratory therapists. They don't have clinicians that attend respiratory therapists. So they are working towards that goal to have respiratory therapists in South Africa. So if you are a respiratory therapist from your home country, you need to get the authorization in another country to be able to practice in a program like that. And obviously, in a country that respiratory therapist hasn't been established, it becomes a bit of a challenge. So that is why the Africa Respiratory Care Association has been formed so that you can also be the voice to help strengthen this profession across our continent. Thank you very much. And how do we get the webinar recording? Okay, so this is one of the questions that come up. So you visit our YouTube channel. So Africa Respiratory Care, on our screen, we have the YouTube channel. So the YouTube channel has the recordings of all our webinar sessions over there. So you can see that of 2025. And obviously, this particular webinar would be edited and then posted on the YouTube channel. So you follow us on our YouTube channel for all the sessions. Um, okay, so from Elizabeth Toku in Ghana, she said, well done, presenter. Please, is critical care nurse allowed to do RT? This I want to give it to the presenter.
Hi, Elizabeth. Thank you for your question. Yes, there's no limitation to you joining the respiratory therapy program in Ghana, provided you meet the requirements for admission. So, irrespective of your background, if you're a critical care nurse, you have more experience. We currently have one respiratory therapist who was previously a working nurse and has transitioned to become a respiratory therapist. So, yes, please feel free to reach out to me through the GARC page, and or if you're not sure, you can just send a message to the ARCA and they would redirect you to the Ghana Association for Respiratory Care and will take you through how to become a respiratory therapist if you're already a practicing critical care nurse.
Okay, so please keep your questions coming. Okay, so we have also some international guests participating with us, and I'd like to give the opportunity for them to say a word or two. So we have a professor from Boise State University in USA. Um, he is in the person of Peter Jaswiko. So Peter, if you can unmute your mic and then say a word or two, he is also a respiratory therapist. So he has something to share with us for Ghana. Thank you very much.
Oh, hello. My name is Peter Jaswilko. So I actually work for two schools. I'm a full-time professor at Triton College, which is a college in Chicago. And I also work as an adjunct faculty for Boise State University. I've been a therapist for over 25 years, and I'm actually looking forward to working with respiratory therapists across Africa. And I'm actually traveling to Ghana in May on a mission trip, so I'm looking forward. And if anybody has any questions, I'm always available. You can contact me at Peter Jaswilko at triton.edu, or just go to triton.edu website and you can find my name there. I'm more than happy to assist anyone who is kind of venturing into the field of respiratory therapy, has any questions, or needs guidance on the best way to get started in this profession.
Okay, thank you very much.
You're welcome.
Okay, so Candy Afote Reese directed his question. He said, what has been the biggest barrier in integrating respiratory therapy in the Africa healthcare system? So that is what he wants to ask. I would answer this question, and then the director for programs and projects for ARCA would also take it up. So some of the barriers that has come up has to do with uh, um, our own people. So when I say people, I mean we have barriers with awareness of the profession itself, who we are not. Okay. And then that is why the Africa Respiratory Care Association has designed webinar sessions like these to give us more education and awareness on this profession and how we integrate with the healthcare team. So most of or some great barrier has been awareness. So that is what I can say regarding that. But meanwhile, there are great successes with regards to our Ministry of Health, Ministry of Education, some universities in Africa and also in other international countries. As members of ARCA, they are actually seeing the light, seeing the whole profession, and want to integrate that into their university system. At this point, I want to give Dr. Olugbenga the opportunity to also add a word or two. Dr. Benga?
I'm sorry, what was your question, Dorothy?
Okay, so the barriers with regards to integrating respiratory therapy in the Africa system, yeah. So biggest barrier, yeah.
So I could speak for Nigeria because currently Nigeria is in the process of starting a respiratory therapy program. From some of the pulmonologists that I have had conversations with, one of the barriers that they actually have identified is, like any allied health profession that starts in the country, it gets to a point where they do not really want to take orders from physicians because they think that they are practicing, they're working as a doctor as well. And I inform them that that is not the respiratory therapists are not providers. We work under the orders of a doctor, and that is the biggest barrier that has been identified now. Thank you.
Thank you very much. Please keep your questions coming.
So we have a question said, has ACA approached other African societies like the Pan-African Thoracic Society?
Oh, thank you very much. So ACA has been in the discussion with Pan-Africa Thoracic Society to help champion this cause across the continent. And then in various countries as well, we have other societies that we have started reaching out to, some of which I could mention, not all, but some of which. I can say Ghana Thoracic Society. We've also reached Ghana Critical Care Association. We have also in Nigeria. Nigeria is very unique in approaching this. Nigeria has also formed the Association of Respiratory Care Therapists Nigeria to help champion this cause in Nigeria. So there are lots of organizations that are identifying this organization in Nigeria to see the vision that we want to impact. So that is just to mention a few. So we have organizations that we are reaching out to. Yeah, thank you very much. I also want to give the opportunity for Trey Garrick. He is the country director for Tanzania. He can also make mention of the barriers and some challenges and some successes that he has seen. So Trey, you are muted, please.
Good evening, you guys. Can you hear me?
Yes, we can hear you.
We have had some barriers as well, even here in the U.S. As the doctor had mentioned, taking orders from a respiratory therapist, we do not operate on our own. We do operate under the direction of a physician. There are policies and procedures that have to be followed, but we don't practice alone. And that's one of the things. I was speaking to one of the physicians in Tanzania, and he thought we practice alone. We do have a lot of autonomy, but we do practice under a physician's license. So that is one of the big barriers. And I know in Tanzania, people don't understand what respiratory therapist does. So it's our job to educate and make that happen and get that understanding between each of us.
The Africa Respiratory Care Association is excited to announce that we've officially transitioned to our new web application. Visit africaresp.org and click Join as a member to become part of a growing community dedicated to advancing respiratory care across Africa. You can also donate on the website to support ARCA's vision and help us expand education, advocacy, and impact. Your contributions help us reach more people and improve respiratory health outcomes across the continent. Join us. Support the mission. Be part of the future of respiratory care. Visit africaresp.org today.